Now to a new warning from the World Health Organization, issuing a statement saying there's currently no evidence that recovered COVID-19 patients cannot be reinfected with that virus. Joining me now, Dr. Danielle Ompad, Assistant Professor of Epidemiology at NYU School of Global Public Health. This sounds significant, as I say, a happy Sunday morning to you. Is this a matter of time and getting definitive proof, or is it just a reminder of how little we really know about this virus?
Good morning. Thank you for having me. So I would say that it's both time and waiting for definitive proof. So we've only known about this particular coronavirus for almost 4 months, not quite. And so we're still waiting to see what we can find out about the course of disease. So we're honestly, this is not hopeless, but at this point we don't have enough evidence to say that any infection will provide protective immunity.
So are you all in then on the prospect of testing? Because if we don't know at this point that antibodies indeed guarantee immunity, the question has to be asked, what's the point of this kind of testing?
So there are two main points for this testing. One is if we do continued testing on people and then follow them up and see what their outcomes are like if they get reinfected, then we'll begin to have a sense about whether or not we're going to have protective immunity or not. The second thing is if we get tested, we get a better estimate of the overall death rate for COVID-19. So most of our mortality rate estimates have been based on the testing that's been done so far. That's typically been concentrated among people with moderate to severe disease or healthcare workers. And so it's not a representative sample of everybody who's been infected. So it's likely that current mortality rates have been overestimated. And we've seen a few studies in the past week from New York, from Santa Clara, and from LA that actually suggest that more people have been exposed to COVID than previously known. And that means that the mortality rates are not necessarily as high as had been previously reported among the severe cases.
All right. Well, Dr. Danielle Ompad, thank you so much. Good to speak with you. We'll see you again. Meantime, new